Senator Bernie Sanders is catching the attention of the president and even some possible challengers in 2020 by introducing his longtime passion, a Medicare for All proposal, this week.
The sweeping reform plan that calls for single-payer universal health care was a frequent talking point for Sanders on the campaign trail. It was summarized by President Trump as, quote, a curse on the U.S. and its people. Here to talk about it is Anna Palmer, senior Washington correspondent for Politico. Anna, good morning.
Good morning.
What are some of the highlights of this legislation?
It sounds pretty good, right? It means you would not pay any premiums or deductibles. Your Medicare would expand to dental, vision in 4 years. All of this would be covered. So as far as kind of you and me looking at it, it sounds pretty good.
How do you pay for it, though?
The big question, right? And that is something that Sanders has really struggled to actually talk about. This week he put out a proposal saying we're going to increase payroll tax, we're going to increase taxes on the wealthy. But I think there's a lot of skepticism that they can actually find the way to pay for all of this.
Right.
There are 16 Democratic senators who've lined up in support of this. Is that about what you'd expected?
Well, look at this. In 2013, not a single other Democrat supported this bill. So this has been a big shift for them. Clearly has to do with his success on the campaign trail in 2016 and trying to figure out how they can get those primary voters.
Is some of this also maybe shift to 2020 and who we may see in the race?
Oh, yes. We are already in the Capitol. There's already a 2020 watch happening every day. And it is certainly, in terms of what I think Sanders wants, is a litmus test. He wants to get all of these potential senators, Kamala Harris, Kirsten Gillibrand, and others who might run on the record here.
Right. So, but I mean, at the same time, there's very slim chance this legislation's going anywhere. So what's the purpose?
Yeah, I mean, slim is
generous.
Generous at best. No, I think this is definitely a Sanders getting people on the record so that when Democrats were to take power in Congress and in the White House, this would be something that would he could move forward.
When we see this, though, in other countries and it works, people start to wonder, as you said at the very beginning, this looks great. It looks great. We all have health care. Why is it so difficult to achieve here in the U.S.?
I think this is the frustration that a lot of people have in Washington. It's hard to get anything done. I think, as Donald Trump said, healthcare is a lot harder than he thought it was going to be. There's big business involved. You'd have the health insurance companies, pharmacies, everybody that might not want their piece of the pie to be less. And so I think there's a lot of complications when it comes to healthcare, and they've really had a hard time trying to figure out how to move forward.
What would have to happen, do you think, for healthcare to become, a significant issue that you could find agreement on?
I think what's going to be interesting is this next week, right? You're having this bill that's going to move forward on Obamacare repeal. So there's definitely a lot of talk about it with Republicans and Democrats trying to figure out a way forward. But I think you'd have to have a real shift in terms of everybody kind of getting on the same page about how they think they should move forward with it.
So where do we go with health care then?
That's the big question, right? And I think right now you're having Republicans really struggling with that in Congress because they promised, repeal, replace for 6-7 years, and they've really failed to do that so far. There's no indication right now that there's going to be successful in the short term on this.
All right. Anna Palmer, thank you.
Thank you.